Sirikal mapacho ka oketo kang' maduoko piny midhiero ma jotuo kaloe ka giwuotho kuom safar maboyo e yor manyo thieth kuom keto ayanga gik thieth minyalo wuothgo kowuok e gweng' achiel nyaka machielo. Gige thieth go biro miyo jochiw thieth yot mar chopo ir jotuo ka bende thiro nengo mar wuoth kuomgi. Nyoket gi ayanga e romo manyorumo nyoro kendo kelo jochiw thieth mag oganda mawuok e konde duto mar Kenya makwan gi romo 5,000 ma obagi buore Nairobi.
This is in alignment with the universal health coverage, even following the address that we just listened, even from the Deputy President or even President, about their work in terms of making the community health promoters able to help the Ministry of Health reach the services to the people, even to their homes. I learned that even rapid malaria tests can be done at the homes. This is in congruence with what we are doing now.
We are very affordable. I'll give an example for Egypt. Our company is able to reduce the diagnostics cost by 40%. So if we replicate this in Kenya, we'll be able to achieve diagnostics at an even much affordable price, where we are talking about primary health care. Primary health care taken to the roots. This is how we do it, by making sure even the person at the farthest region is able to afford the cost of the testing, and they can be diagnosed early.
We are very potential to have a collaboration with many different sectors in terms of the governmental sector, starting with NASCOP, National Public Health Institute, and KEMRI as well, in terms of the diagnosis.